Hello friends, today we are coming with new video and very most and useful information we are going to give you on. Today we are seeing about the slit lamp examination. In slit lamp examination, we see part of slit lamp, optics of slit lamp biomicroscopy, routine and method of slit lamp using. Slit lamp examination. The slit lamp biomicroscope was invented in 1911 by Goldstein. Today, biomicroscopy forms an invaluable and indispensable part of ophthalmological examination. Now, friends, we are seeing about the part of slit lamp. The slit lamp consists of three parts. First, observation system means microscope. Second, illumination system means slit lamp. And third, mechanical system or engineering support. These are the three parts consist in slit lamp examination. Now friend, we are seeing about the what are the optics of slit lamp. It works on the same principle as a compound microscope. The objective lens is plus 22 diopter is toward the patient whose eye form the object. The objective lens consists of two plano convex lenses with their convexity facing toward each other. The eyepiece is plus 10 to plus 14 diopter and is toward the examiner. The illuminating system can be adjusted to vary with the width, height and angle of incidence of the light beam. Now friends, we are seeing slit lamp biomicroscopy routine. While performing slit lamp biomicroscopy, the route may be adopted. First, patient adjustment. Patient should be positioned comfortably in front of slit lamp with or his or her chin resting on the chin rest and forehead touch the forehead rest. Second, instrumental adjust. The height of the table housing the slit lamp should be adjusted according to the patient height. The microscope and illumination system should be aligned with the patient eye to be examined. Fixation target should be placed at the routine position. Beginning slit lamp examination, some points to be kept in mind. First point is examination should be carried out in semi-dark room so that the examiner eyes are partially dark adapted to ensure the sensitivity to low intensity of light. Second, diffuse illumination should be used for as a short time as necessary. Third, there should be a minimum exposure to retina to light. Fourth, medication like ointment and anesthetic eye drop produce corneal surface disturbances which can be mistaken to pathology. And fifth, low magnification should be first used to locate the pathology and higher magnification should then to use examine it. Start with diffuse illumination and examine the lid margin, bulbar conjunctiva, limbus, cornea, tear film, aqueous, iris and the lens one by one. Now friends, we are seeing about the what are the method of illumination. There are 7 basic method of illumination using slit lamp as we are describing. First method is a diffuse illumination. Diffuse, a broad beam of light is used and general view of anterior segment of eye is observed. Second, direct illumination. The slit beam and microscope are focused on the same area and examination is performed. Change in the corneal stroma and epithelial are better known by this technique. Third, indirect illumination. The slit beam is focused on position just beside the area to be examined. Corneal microcysts and vacuoles can be best observed by this method. Retroillumination. Light is reflected off the iris or fundus while the microscope is focused on the cornea. This technique is especially helpful in detecting corneal edema, neovascularization, microcyst and infiltration. Fifth, specular reflection. Here the angle between the slit lamp and microscope is increased to 60 degree. Angle of incidence is equal to the angle of reflection. Changes in the endothelium like polymegathism, gotate can be viewed by this method. Sclerotic scatter. It is utilized the phenomenon of total internal reflection. The slit beam is focused at the temporal limbus, and as it passes through the cornea, it outlines any substantial stromal or epithelial opacity which may be lie in the path. 7. Oscillatory illumination of copy. In this, the beam is given an oscillatory movement by which it is often possible to see minute object or filament, especially in the aqueous, which would otherwise escape the direction. So friend, these are the 7 methods of slit lamp examination.